Welcome to the third video of the series related to clinical teaching, in which we will be talking about the models that we will be using in clinical teaching. In the previous video, we start with introduction to clinical teaching. Then we talk about clinical teaching at the different settings, bedside teaching, at ward, outpatient, and in the lab. And in this video, inshallah, we'll be talking about teaching models, the different models that we can use. This is a very important framework and a simple framework that we can follow. For any clinical teachings, we have to use WAS framework for teaching, which is simply outcome, activity, and summary. Outcome, we have to state the learning outcomes out loud to the learners before starting any clinical teaching. We have to assess the learner prior knowledge, and we have to plan for the environments, as we explained, considering the 4 domains of the learning environment in clinical setting. I encourage you to go back and watch Introduction to Clinical Teaching video, in which we explain the learning environment. And in a direct way, you should inform the learner that today you will practice a focused cardiac history, for example. The second element of this framework is activity, in which you think about assigning specific roles before the encounter, whether learner will do or they observe. And you have to think at this clinical setting. For example, learner will do, not watch only, or in some situations they may observe, particularly when they are novice to surgical procedures. Always try about using a framework for asking questions. Maybe you can use Socrates framework and so on, and you'll find videos related to how to ask right questions within this YouTube channel. So it's very important to ask questions that promote thinking in a good way. You have to involve all learners, not just the focal ones, the brilliant students or the brilliant residents. You have to summarize the key points explicitly and to give specific immediate feedback. And you have to ask, what will you do differently next time? Very important to assign a self-directed learning task following the setting. Now, let us move to the first model that you can use in clinical setting teaching. This model is called one perceptor model. And in one perceptor's models, it is a 5 steps. And these models work in any clinical setting. It is very important in this model, I will go through the 5 steps. The first step is getting commitment. And getting commitment actually is the most commonly skipped. Without it, there is nothing to teach from. It is very important to get commitment from the beginning. And the importance of getting commitment, it helps you to diagnose the learner's reasonings, not their conclusions. And you can establish getting commitment by asking, what do you think is going on with this patient or where? Then move to the second step is probe for evidence. And the importance of probing for evidence is to expose the analytical process. Where does reasoning fail? And hereby asking, what led you to that diagnosis? After getting commitment and probing for evidence, then you teach the general rule. And you think about the transferable principles here. Don't rush the learners with everything you know, the principles. And also consider the level of the learners. And you can simply say that a useful rule here is to do the following with this case or with this patient. The fourth step is to reinforce specifically. Focus on specific behavior, not vague. Focus on using a constructive feedback here, such as you correctly identify this because Y. You have identified X because of Y. And the fifth and final step is to correct constructively and apply the principles of the feedback here, privately, specifically, and always link to the patient safety. Such as one thing to reconsider in the future is the following. So now we cover 1 minute per chapter. Now let us see the other one is called SNAP model. And the SNAP is abbreviation of summarize, narrow, analyze, probe, plan, and select. And this very good for senior learners. Summarize is a concise 2 to 3 minutes, summarizing the history and findings. Narrow to differential 2 or 3 most likely diagnoses, then go to the analysis, compare and contrast. Why did you say this? What about this? And then for the probing step, which required explicit permission. In the clinic, you are expected to ask me question. You can use probing. For example, the learner asks perceptors about uncertainty or about something that is not clean to them. And also, your role is to help the learners to reflect and to think in the probing phase. For the plan, the learner initiate management plan and discussion. And finally, for select, the aim here is to identify a self-directed learning issue for follow-up. Now, we will be discussing the final stage phases of this series of videos, which will be related to role modeling and professionalism. As you know, we have the formal curriculum in which we have the curriculum, the manual, the assessment, and we have the hidden curriculum. And if we look about the percentage, 80% of the professional formations come from the hidden curriculum. Residents, learners learn from us as the clinical educators how supervisors interact with patients. Sometimes many supervisors, many trainers teach professionalism, but unfortunately, their practice work against professional behavior with the patient. So we have to be serious with this. It's very important also to consider in hidden curriculum how mistakes are handled by the team. Are we developing blaming culture or supportive, educating, saving environments? If we make a mistake as educators, are we admit this mistake or no? This is very important. How the other staff is treated within your team, the nurse, the supporting staff, and other important part of the team. This is very important because one of the problems of clinical teaching and clinical service delivery is the teamwork and communication, and this will contribute negatively to the patient safety. We have to stop here and ask yourself, what happens in the clinical rounds when a learner answers incorrectly? Are we dealing with respect with the learner, or we are humiliating the learners? If we are humiliating the learners, then we are creating unsafe learning environment. And please try to make sure that in your department there is no such behavior. You have to reflect, are the questions are welcome from your residents and from your students, or no one is asking you questions. These very important things that need to be considered regarding the hidden curriculum. Regarding the role modelings, we have two types. We have implicit model and explicit model. Implicit models, teacher behaves professionally, learner observes this, but may not recognize what they are seeing. And the educational impact of this approach actually is moderate. The explicit modelings of role modeling, the teacher name what they are doing, the clinical educator name what they are doing. For example, notice I put my phone away while listening to the patient. And in psychology, when you put your phone between you and another person, this will create a barrier, as if this phone is important than the other person. So it's very important to be cautious while putting phone in communication or other aspect that may be considered as a barrier in communication. And you can explicitly, as a clinical educator, say that I have sat down, put my phone away, make my eye contact with the patient, and I do this with every patient receiving difficult news or whatever. And this is, the educational impact here is slightly higher. The positive role modeling, for example, sitting beside at eye level, introduce every team member, say, I don't know, let's find out together, treat all staff with equal respect. Example of negative role modeling, humiliate the learner in front of patient or peer, make dismissive remarks about nursing staff or colleague, never admit uncertainty or error. The next slide will be summarizing the principles of clinical teaching that we have explained in this series of clinical teaching. Whenever we teach in the clinical setting, we have to prioritize patient, we have to be patient-centered. We have to create psychological safety. We have to make thinking visible. We have to observe directly, and we have to provide actionable feedback. We should not neglect reflection. We should aim at developing clinical reasonings, and we should explicitly teach positive role modeling and be role model. We have to know about coaching skills and mentoring skills and academic advising skills, and we will have specific videos related to coaching, mentoring, and advising. You have to foster lifelong learning in academic teaching. So clinical experience alone doesn't produce competence. This is very important. Take away message from this series of videos. Learning requires deliberate practice and deliberate educational design. Without establishing safe environment, we cannot enhance deliberate practice. Without being trained in clinical teachings and reflect on the way that we are teach, we will not improve our style of teaching. And please make sure that we are educating future healthcare professionals. If we educate them in a right way, then they will practice in a correct way and right way, and this will be contributed to the patient safety, people well-being, and population health. Thank you so much for watching this series of videos, and the next series of videos will be about simulation-based education in health profession education.